Hello! In my last presentation, I talked about antibiotic resistance on dairy farms and how antimicrobial stewardship is part of the solution to the problem. Now, in this short video, I want to tell you why some antimicrobials are more important than others for human medicine. There are two criteria to categorize antibiotics according to its importance in human health. The first criteria is if the antibiotic is used to treat serious human infections. Serious human infections refers to those illnesses which, if left untreated, they are likely to cause death. For example, meningitis, pneumonia, or bloodstream infections. The second criteria is if the antibiotic is the sole or one of limited available therapy to treat human infections. For example, fluoroquinolones are one of the limited options to treat invasive disease due to Salmonella. If an antibiotic meets the first criteria, it's the treatment of serious human infections, and also meets the second criteria, it's the sole or one of limited available therapy to treat human infections. This antibiotic belongs to category 1. It is considered very high important for human medicine. It is very important to preserve these antibiotics and to keep them working. A loss of efficacy in these drugs due to emergence of resistance would have a big impact on human health with increased mortality. For that reason, this category is also called critically important antibiotics. These are the very high important antibiotics or critically important antibiotics that could be used on dairy farms. In this category, we have ceftiofur, which is not used in humans. However, resistance to it confers resistance to several category 1 drugs that are important in human medicine. Examples of products with this antibiotic include Exenel, Ceftiocil, and Spectramas. In this category, we also have fluoroquinolones and polymyxins, like special formula. If an antibiotic meets the criteria 1, it is the treatment of serious human infections. However, there are alternatives available. This antibiotic is considered high important antibiotic. It belongs to category 2. Bacteria resistant to drugs of this category are generally susceptible to category 1 drugs, which could be used as an alternative. High important antibiotics includes penicillin, for example, teposilin, propen, and procaine penicillin, cefapidin, for example, Cefalac, Cefadry, and Metricure, ampicillin, like Polyflex, trimethoprim, like Trimedox, macrolides, like Traxine, Sactran, and neomycin, including Neoclor. Antibiotics in category 3 don't meet the first criteria and are used for treatment of bacterial infections for which alternatives are generally available. These antibiotics have medium importance for human medicine. infections caused by bacteria resistant to these drugs can, in general, be treated by Category 2 or Category 1 antibiotics. Antibiotics in Category 3 that we could use on farms include tetracycline, for example, liquamycin, oxymycin, oxybet, sulfonamides, and florfenicol, for example, Nuflor or Resflor. Antibiotics in Category 4 are considered of low importance for human health because they are not used in people, and resistance to these antibiotics do not confer resistance to any of the antibiotics used in human medicine. In this category, we have the ionophores, which are used as feed additives in dairy farms. And how this information relates with antimicrobial stewardship? Well, with this information, I'd like to reinforce the R for responsibility. When you use antibiotics, you acknowledge that there are some drugs more important for human medicine than others that we need to preserve. And also the R for refinement. Consider using antibiotics that are not in Category 1. Ideally, most of the antibiotics used on farms belong to Categories 3 and 4. Thank you so much for taking the time of watching this video. If you have any questions or any comment, please don't hesitate to write an email.